Hi everyone, Dr. Jeff back with this week with co-op student Willow. And I know we got a great topic this week. It's a neurogenic or a nerve topic we're going to talk about this week, which is
Thoracic Outlet Syndrome. So what it is, causes, different signs and symptoms, and ways to treat it.
So thoracic outlet is up here. You have a little triangle up in your shoulder here between your neck and your shoulder. And what happens is all the nerves from your neck have to come out and they somehow have to get down your arm. So they come out and they form what we call a plexus, which is kind of like an organizational highway. That has to come down and then go through your shoulder, through your armpit, down your arm to make everything your arm does. It's bordered by the scalene muscles, which are in the front here, and then you've got your first rib that's kind of deep in here. You've got your pec minor muscle that comes up here, so it kind of comes down through here. And any sort of things that can kind of compress that area can cause some compression of the nerves. You also have an artery, you have a vein that go down there as well that can get compressed.
This is a diagram of the thoracic outlet. So first at the top, you can see the muscle there. Those would be your scalenes. You can see that the nerves, arteries, and veins are running through the clavicle and the first rib there. So thoracic outlet syndrome occurs when these nerves and blood vessels get compressed between the clavicle and the first rib.
So there's different causes to thoracic outlet syndrome. One would be a traumatic cause. So say a football or a rugby game, you get hit right in this area by a helmet or a tackle, you get that immediate compression of nerves, so you get that numbness, kind of tingling, pain throughout the arm. Another traumatic cause would be, say, a car crash or a car accident. You can have whiplash, so your head's going to quickly go this way and you'll get strain again through these nerves. Another common cause would be posture, so constantly sitting at your desk or looking down at your phone like this. These muscles up in this thoracic outlet area will get tight, sore, and start to compress onto those nerves. So that again will cause that numbness or weird tingling feeling down the arm. Another common cause would be sleeping. So your sleeping position. I know I sometimes sleep with my arm up like this. This causes opening up this pec muscle here, and again you might wake up with that numbness or tingling because the nerves in this area are kind of getting compressed and in a weird position. So
yeah, thoracic outlet syndrome can come on very quickly. Just like Willow said, trauma to the neck. We see this in football and rugby or like a helmet in there. And that almost like a shock to the nerves, and I call it a stinger, and immediate pain and everything going down the arm. Most commonly this comes on slowly because of bad posture. So you kind of, all of a sudden you feel like, and the most common one is neurogenic, so it's nerve pain. You can get the vein and the artery involved as well, which means your arm starts to turn blue or you lose your pulse. But most commonly it's neurogenic. And again, this is because of the compression of it. And generally it's just kind of bad posture, comes on slowly. You notice your arm's not feeling very good. So you kind of get up and you move your arm around, it seems to go away. But as time goes on, it takes a little longer, and now you start to get some pins and needles and numbness going on. Eventually it gets to the point where you start to lose your grip strength, trying to shift gears in your car become a problem, and your arm starts to get weak. So it can come very quickly or it can come very slowly.
yeah. And there are different treatments for thoracic outlet syndrome. The first being come and see your practitioner, come to see the chiropractor. Since the first rib is part of the thoracic outlet, you could get an adjustment and help with your posture as well. Massage therapy is very beneficial for this as well because you can work on these muscles and loosen them up and create more space for the nerves to run through the plexus here. Another thing would be an ergonomic assessment. So at home or at work, have somebody come in and look at your desk positioning to make sure you're not constantly in an awkward position where your shoulders are up high like this. Another thing Dr. Jeff just told me about is a GPS on your phone. So it'll tell you to hold it up here instead of constantly looking down at your phone like this. Another treatment would be different stretches and exercises to work on opening up this area to reduce the compression and the tight muscles.
So a few stretches here, the first being a scalene stretch. So be holding the front of the neck with your hand, and you'll be looking up into the corner away from your hand. You should be feeling the stretch in the front part of your neck. The next stretch that you will see is a levator scapula stretch. This muscle is located at the back and side of the neck, running from the first 4 cervical vertebrae and attaching onto the upper portion of the scapula. For the levator scapula stretch, you'll be grasping your hand underneath of a chair and pointing your nose towards the opposite armpit for the side you'd like to be stretched. You should be feeling this stretch through the back and sides of the neck. This is a classic pec stretch against the door frame to help open up the chest. Another pec stretch. Here, your palm will be flat on the wall just below shoulder height. You'll gently rotate your body to the opposite side to feel the stretch. Again, this is targeting the pectoralis muscles, opening up the chest and improving flexibility.
So there's no real surgical method of fixing this. This is kind of all postural. There's no magic pill. There's no needles. It's all has to be done by hand and by exercise and changing your postures at work. And again, posture is one of the number one causes of it. So we need to work on getting your posture corrected.
So that's it for today. I hope you enjoyed the video. If you have any questions, comments, please leave them in the comments down below. And if any future video ideas, we'd love to hear them.
Yep. And make sure you share it, make sure you like it. And here it goes with the chiropractic. We got your back.